afternoon. Thanks for being here. My name is Lauren Williams, and I am Adult and Community Services Manager for the Columbia Public Library, which is part of the Daniel Boone Regional Library System. Welcome to today's Lunch and Learn. This program is co-hosted by the library and the League of Women Voters of Columbia, Boone County. Today, we'll be hearing an update on the use of funds by the city and county, use of funds from the CARES Act and the American Rescue Plan. Now I'd like to welcome our moderator, Marie Scala. Marie is a Columbia Boone County League of Women Voters board member and a Columbia Boone County Board of Health member. So thank you, Marie.
Thank you very much. And I appreciate all of you being here today. I think we're gonna have a really interesting presentation. Our guest speakers today, as Lauren said, are Matt Liu, the City of Columbia Finance Director, and Janet Thompson, the Boone County Northern District Commissioner. And they're both going to give us an update. As you know, the city and the county have each received funding and will continue to receive some funding through the CARES Act and the American Recovery Plan. And this is your opportunity to learn how that's being spent, how future funds are planned to be spent, and should be very interesting. But before we get started, I just want to announce that we will not have a Lunch and Learn program in July or August. We're taking a break for the summer, as has been our tradition, and we will resume in September. So with that, I'm going to turn the program over. Matt has agreed to go first. And as Lauren also said, please, as questions occur to you as we go along, please enter them in the chat, and we'll try to post them at the end of both presentations. So Matt.
Okay. All right. Good morning. My name is Matthew Liu, and I'm the Director of Finance for the City of Columbia. I want to present to you today some of the uses and the fundings that the city received from the CARES Act and the American Rescue Plan Act, I'm sorry. So the city received CARES funding directly and indirectly from the federal government, as well as the county. And to date, the city has received its first initial funding of the American Rescue Plan. So we'll go over the federally awarded CARES Act funding first. The city received federal CARES funding for 5 categories. They went toward the airport, community development, public safety, tourism, and transit. The total funding amounted to about $26.5 million, with the lion's share coming from the FAA for the airport. And year to date, we've received around $7.8 million. Columbia Regional was awarded $18.7 million, $8 million for operational expenses, which are being funded $2 million a year for 4 years, and $10 million for development. Because the city had a major construction underway at the airport before the pandemic hit, it was deemed that our project was reimbursable, and the new terminal was allowable cost to be reimbursed. So that's why we received so much in FAA money. The next portion is the CDBG CARES Act funding, and CDBG is Community Development Block Grant. There was $573,000 available, but because of the strict guidelines of the program and the short turnaround periods, the city was only able to award about $346,000 of that. So this funding went to organizations to help with rent assistance, micro enterprise assistance or micro enterprise loans, nonprofits serving our homeless population, and temporary staffing to deal with these issues. And again, these were subject to CDBG rules and regulations. The next portion of the money came from the DOJ, or the Department of Justice, um, and it issued a coronavirus emergency supplemental funding in which the city was eligible for about $131,000 in assistance. This assistance was to pay for PPE for the police and fire department. And currently, we have not received any of this money, but we are expecting to receive reimbursement this month. So those grants are being finalized now. The next portion was for the Columbia Convention and Visitors Bureau. They received about $252,000 for the implementation of marketing campaigns, signage, and purchases made related to COVID-19. The last part of the federal money was received by the Transit Department, and it was on behalf of the FTA, or the Federal Transit Authority. The city was awarded $6.5 million in June of 2020, and so far we've received about $4.3 million of that funding. This funding has allowed the city to have fare-free transit on all its bus routes. And it has assisted in covering personnel costs, cleaning, bus repair and replacement, transit facility costs, and other costs associated to the pandemic. In fiscal year 21, the CARES grant will cover 100% of the operating expenses for transit. Okay. Next, we want to get into the County CARES Act funding. So this was money that was provided to the county and then passed down to the city for expenses. Well, here's the breakdown of what the city received from the county. The city received about $9.1 million in funding in total, and $4.2 million of that was directly routed to the health department to aid the fight against COVID-19 as well as contract tracing. Another $4.2 million was spent on public safety, and $674,000 partially funded round 3 CDBG activities. And so, because of the reimbursement of prior expenses allowed by the CARES Act, the city was able to use its own reserve funds to fully fund the CDBG round 3 request from the community, which included public assistance for housing, food security, homelessness, education, and child care access and vocational training. $650,000 was used to pay police and fire overtime expenses, and then another $600,000 has been made available for 2 entertainment and business assistance programs. One is our business license and health inspection rebate program, which will reimburse restaurants and bars for business license, alcohol and beverage license, health inspections, and I believe that is it. And then the other is a hotel and motel and concert venue reimbursement that'll reimburse those venues for COVID-related expenses. So things like purchasing plexiglass and spray and wipes, masks, things of that nature. Okay, now, and then finally we have our city utility assistance program. Currently, it's funded at $300,000. We're going to fund it here to see what the need is and add to it if we need to in the future. But the seed money to start the program is $300,000, and it'll serve persons who are elderly or disabled and families with children age 18 and under, and that are in low-income households. We will provide assistance for utilities and customer for all Columbia residents. So this won't be just sort of relegated to water and electric. It'll be for all utilities for our residents. Okay, so lastly is the American Rescue Act. So I'm just going to talk a little bit about what the city received and a couple other notes. So the city has been awarded about $25 million. 12.6 of that has been received so far, and the city will receive the additional half 1 year from the initial payment. As of date, no determination on the use of these funds have been made, although there are some suggestions, and I believe we will have a pre-council meeting on the 21st to sort of discuss things that can be used, this money can be used for, and potential projects, and I think as well as get some public comment. So there are 4 or 5 major categories for eligible uses for the ARPA, and those are public health, economic impacts, premium pay for employees, investments in water, sewer, and broadband infrastructure, and then reimbursement for revenue loss. So those are the 5 categories in which these funds can be spent. And a few notes on this money, sort of the cans and can'ts of it. The funds are intended to be used prospectively, so that means ongoing and nothing in the future. I mean, nothing in the past. It cannot be used to cover costs incurred prior to March 3rd. We can provide services broadly to the extent of reduction in revenue. So anything that has, this is the only part that can be looked back on retrospectively. So if we did see a loss in revenue in any certain sector, there's a calculation that can be made to kind of determine what that revenue loss was, and we can use funds to basically bring us up to a level that we should have been if there was no pandemic. It can also be used on general infrastructure projects, but these projects have to be responding to a specific public health or economic impact due to COVID-19. So, but lastly, many of these areas of eligible use are required an assessment and reporting to justify use. They've made it pretty strict to where you have to use these monies in these specific areas, and if you don't, the money will have to be repaid to the federal government. And so that's something that we do not want to do. We want to use this funding correctly and put the programs in place that are deemed useful by the ARPA. And that's basically all I have.
Thank you very much. I'm sure people are cogitating. We've got a couple of questions that we'll ask after Janet speaks, but I just want to encourage folks to put questions in the chat as we go along while they're at the top of your minds, and we'll turn it over to Janet.
Muted. There you go. There you go. All right. Thank you so much, Mari. And I appreciate the opportunity to talk about this because this has been, I know, all consuming for us over the last year. And I know Matt's also been in it up to his eyeballs as we've tried to navigate through the land of federal legislation. You know, last year, as the pandemic really tried to grab us by the neck and wrestle us to the ground, jurisdictions from across the country began to wrestle with this piece of legislation that now we're using the shorthand title of the CARES Act. And through the CARES Act, Boone County, as Matt alluded to, we received here in Boone County about $21 million in sorely needed funding. But even before we got that amount of money into our bank account, we were receiving countless requests for funding from small businesses, from schools, from hospitals, from not-for-profits, requests that totaled far more than $21 million. And so all of a sudden, 21 million didn't seem like a lot of money anymore because of the scope of everything that was being requested and legitimate requests. We realized several things early on, and Matt's alluded to this, but I wanted to kind of highlight this first. The first thing that we saw was that the changes that we were experiencing here in Boone County were changes that were being felt across the country and across the world. We were all learning as we were navigating through the process. We were all pivoting, we were pirouetting every single day. And as we learned, we adjusted. And the Treasury Department was also adjusting every single day. As Matt alluded, they changed, they revamped, they tweaked, and they discarded rules, the rules of engagement practically every day. And so that meant that we had to stay on high alert throughout the process because, again, as Matt said, if we did not follow the Treasury Department's rules to the letter, we risked having to repay that money to the federal government. And what that meant was, for instance, I'll look at the people on this call that I'm seeing, the faces. Say if Daniel Boone Regional Library made a request for funding, and we decided that was a legitimate request, and we went ahead and allocated money to Daniel Boone Regional Library. But that if Treasury Department said, "Gosh, you didn't follow the rules," they would come back and say to us, "You, Boone County, have to refund that money to the federal government." It wouldn't have come from Daniel Boone Regional Library. It would have come from the county of Boone. So we were very, very cognizant of that from the get-go. And that was something that really was impacting a lot of other counties' approach to the CARES Act funding. There were counties that simply returned the money to the federal government and did not spend that money within their jurisdiction because they were so scared of the possibility of having to refund that money to the feds. So our approach was very different. We said we will follow the letter of the law. And we said, we have to be accountable. We have to adhere to the controlling law. And those two things were our highest priorities. And our second highest priority was that we were going to spend every single penny of the money that was allocated to Boone County here in Boone County. And that's what we did because we wanted to make sure that we got the benefit of that. So those concepts led to our first purchase. And that was a software package that helped us to create the portal through which folks could apply for funding, and then would allow us to track every bit of the funding that was sent out and really manage that funding in that way. So that was something that allowed us to better utilize the time that was being expended by members of our Office of Emergency Management, from our auditor's office. Our auditor and all of her staff spent countless hours helping to figure this out. Our human resources department, our legal department, all of those folks they tracked the requests for funding. They determined eligibility under the Act. They helped us figure out how to compare apples to apples within certain areas of concern, and also looked at and helped us look at the allocation of funding throughout the county, because there were requests from Centralia to Ashland, from City of Columbia to Daniel Boone Regional Library, from not-for-profits through healthcare. So all of those things were coming at us. But the second major expenditure that we made, really, it's kind of like the beginning of this process is now reflecting what we're seeing now. Because when this whole thing started, and I think all of the people on this call probably have experienced this to some degree or other, you know, before the pandemic hit, a lot of people sort of were aware that broadband was an issue. But once it hit, you know, what we're doing right now, joining together on a Zoom call, is not even possible for people if you don't have adequate internet coverage, right? And last year at my house, for instance, I can no more get on a Zoom call than fly to the moon. So I ended up in a McDonald's parking lot. You know, I was wandering around the county trying to find places where I could get on a Zoom call. And so as the pandemic took hold, we saw more and more that being able to do your schoolwork, being able to do your work from home, being able to talk to your healthcare provider, being able to join with your friends and fellow parishioners in a worship service. All of those things were being impacted by whether or not we had internet. And so at that point, the first, like I say, the first question for us was getting that software package in place. The second question came from all of the superintendents of school, because they said, we've recognized that our kiddos who are trying to learn virtually can't because no internet. So they came to us, and a bit over $500,000 went out the door almost immediately to pay for hotspots. So that was the first expenditure to really try to target what was happening here in Boone County, due to the pandemic, the enhanced need for that due to the pandemic. So from there, again, following, you know, and this sounds like a broken record, but every decision we made was driven by Treasury Department guidelines and by the legislative act language. You know, what could we do? And our hearts might have said, gosh, we'd really like to do that. But if it wasn't permissible under the act, we couldn't do it, because we knew that we'd have to subject Boone County to the possibility of having to repay it. So we divided up all of the potential uses of funding into various buckets. And one bucket was schools, allocating funding to school districts across the county, to hospitals and public health. And the hospitals included Boone Hospital, University Hospital, Compass Healthcare, and the health department. So that was a second piece. We looked at public safety. We looked at public PPE. We looked at higher ed PPE. And we also looked at not-for-profits. And we looked at, again, as Matt said, you know, there were issues about people who needed help with their utilities, those kinds of things. And so we reached out to some of the not-for-profits who had the expertise in being able to distribute that funding to small businesses or to individuals that needed that kind of support. We in fact contracted with Randy Cole from the City of Columbia to be able to help us help some of those small businesses. We contracted with Central Missouri Community Action to make sure we could get help with utility payments out the door to more and more people here in Boone County. So those were how we managed that fund. Again, always looking at the guiding legislation. And so when we look at how the money went through, and if people have specific questions, I can answer that. But 14.2% of the funding under the CARES Act went to the schools. Public health and the health department, that was 34.5% of the funding. Public safety, excluding the health department, received 31.7% of the funding. Public entity PPE received 5.1% of the funding. Economic assistance, again, CMCA and the small business folks through Randy Cole, that was 6.3%. Higher ed PPE, 7%, and not-for-profits, the remainder of that fund. So that's what the landscape looked like. And again, you know, it was one of those 21 million didn't go near far enough, but we spent every single penny here in Boone County, and we were thankful for receiving that money to help us through. And now, you know, as Matt said, we're looking at the American Rescue Plan Act, and we're calling it ARPA. And for anybody that has any questions about some of the guidance, and I think Lauren's going to help us out with some of this information and post it in the chat, but we were getting a lot of the guidance through, again, Treasury Department and the National Association of Counties. And National Association of Counties had folks that were linked to the Treasury Department. They were getting information every day from Treasury, and then they were bringing it back to us. And so we were involved in phone conversations with people at NACO every week, and really trying to keep abreast of the changing landscape through the National Association of Counties. So that was where we started. And now what we're looking at again is under ARPA. I think the feds learned some lessons from the CARES Act. And the purpose of this act is to provide that substantial infusion of resources to help turn the tide of the pandemic, to address economic fallout, and to lay the foundation for a really strong and reliable recovery. And I think of this in terms of they're suggesting that we not just fill a pothole, but build a road, right? It's that kind of system. We've been given guidance from the federal government to really make that investment in our community that's going to create that system change, that creates something that will make us more resilient if we're faced with this kind of situation again. And so, again, to kind of reiterate what Matt was talking about, the funding objectives for this are to support urgent COVID-19 response efforts to continue to decrease spread of the virus and bring the pandemic under control. And so in that, you know, we're authorized to fund COVID-19 mitigation efforts, to fund medical expenses, behavioral health care, and certain public health and safety staff. We're looking at, again, this is under the Act, replacing public sector revenue loss to strengthen support for those vital public services, help retain jobs, use those funds to provide government services to the extent of the reduction of revenue that we experienced due to the pandemic, support immediate economic stabilization for households and businesses to respond to those economic harms that have been experienced throughout our society. One of the things that, you know, we always look at here in Boone County is to address systemic public health and economic challenges that have contributed to the unequal impact of the pandemic. That's something that's authorized under ARPA. Specifically called out under ARPA are water and sewer infrastructure. Again, because that's something that you look at and you go, gosh, we may need that, but how are we going to pay for this? This is a long-term big project. Let's make necessary investments to improve access to clean drinking water, invest in wastewater and stormwater infrastructure. A big one that's called out because I think Congress said, let's look at what we call infrastructure more broadly. They've called out broadband. And they've said that's something that, you know, back in the 20th century, what was called out as a big piece of infrastructure was electrification. For us now, the correlation is broadband, to get people hooked up so that they have access to that viable internet wherever they are for all the multiple reasons that we use that. And then offer additional support to those who have and will bear the greatest health risks because of their service in critical infrastructure sectors. So it's those kinds of areas that ARPA is saying these are viable areas. And again, because of our participation in NACO, we've already heard about a lot of efforts that are going on in other counties that are saying, gosh, if we're going to make that big system change and really create something that's viable that brings us forward into the post-pandemic world. One county in Kentucky, actually Boone County, Kentucky, that was brought to our attention. They're spending their money to connect every household with broadband. Every single household in Boone County, Kentucky, and they're bringing it to their door. So Boone County, Kentucky is much smaller, but Judge Gary Moore has pledged to do that with the ARPA money. And he's also using some CARES Act funding to do that. Another county, Douglas County, Kansas, is using its money to create an access center and to fund not only the access center, but all of the relationships, the people that will create the connections between the access center and law enforcement, so that we don't continue to put people with behavioral health challenges into our justice system, into our county jails. So they're looking at things that have been situations that have been exacerbated by the pandemic and creating, again, that road rather than filling the pothole. So those are the kinds of things that we're looking at. As Matt said, we also have gotten half of the 35 million that has been allocated to Boone County. It's come in, and it will come in again, as Matt said. There's when you get the first tranche, the second tranche will come a year on. All of this money has to be allocated by December 31st. The Congress learned how many days December has this time around. So by December 31st of 2024, all the money has to be allocated. But so that gives us a little bit more time. It's easier. I think Matt's office was also hyperventilating, making sure that we could get the CARES Act funding out the door in the amount of time that we needed to under that program. We've got a little bit more time to be a bit more deliberate in how we allocate this money. But this is a process of making sure that 35 million, again, it's kind of like the 21 million in the CARES Act. 35 million doesn't go as far as we want. It can't meet all the needs, but I think we have to look at the guiding legislation and then say, how's the best way to bring Boone County into a post-pandemic world in a very healthy, vibrant way. So,
well, thank you.
Give it back to you, Mari.
Okay. Well, we do have some questions coming in, but I'm going to take the moderator's prerogative and ask mine first. And that is, I think we can all kind of intuitively understand that expenses went up during the pandemic. But I'm not as familiar, and the other viewers may not be, with what happened on the revenue side of things. So if you could, I don't know if you have any final figures or any preliminary figures to share, but did our governmental revenue drop drastically, or how did we fare through the pandemic? And that's for both of you, of course.
Well, I can kind of speak to what we've seen at the city. So we did not see a drop in sales tax, and it was mostly due to our big box stores doing very well. You know, people shopped a lot, but we did see decreases in all of our gross revenue, gross receipt tax. So things like telephone, cigarette, utility tax, pilot payments, utility tax, things of that nature. We've seen a drop in all of those. So it was sort of a give and take.
Sort of a mixed bag then. And Janet, do you have a sense for the county?
So, you know, I was surprised that the sales tax we didn't see the drop that was predicted in sales tax. And I think every time we got that report from our auditor's office, she was also surprised at how vibrant it was. And I think Matt's right. A lot of that was coming from folks who were shopping locally. On the one hand, you know, they were shopping as more probably at Walmart and those kinds of things. But at the same time, we know that there were a lot of people, and I think this is the fear and the hope with have the legislature having at least made the possibility of us moving forward on the Wayfair legislation. You know, the fear is that we're so many people that actually were shopping online, and that became a habit. You know, it was one of those, I'm worried about getting out and shopping in person, so I'm going to do my shopping online. And without having that that local connection, and without having the Wayfair fix, then our brick and mortar stores will continue to suffer, and we will see that continued drop in sales tax revenue. And our budget is largely built on sales tax revenue. So that's one of the things that, you know, I mean, people were protecting themselves by shopping online, but, you know, we're hopeful that they'll come back and really support brick and mortar, because those brick and mortar stores rely on us to keep going.
That's definitely true. We've seen that same sort of activity, especially like with the turnover in businesses. But we've seen a lot of businesses leave Columbia during this pandemic, even though we've had a lot replace them. But yeah, that's definitely an issue that we see as well.
Okay, thank you. Harking back, this question I think is for you, Matt, although Janet, you're welcome to chime in as well. But harking back to early in your presentation, and I think this question, which is in the chat, refers to the CDBG grant funding that went unexpended. The questioner just wondered if you could give a further explanation of that, why that happened. You're muted, Matt. Sorry.
I'm sorry. Is this for the CDBG? I see it says mentioned as COL.
Oh, maybe I'm wrong. Anyway, there was one where you got like 500 and some odd thousand, and then we're only able to.
Yeah, that's the community block grant funding, and there are a lot of restrictions in that, and there was a pretty short window that people had to apply for it. So you had to apply for the grant funding, and then you had to qualify basically. So if you didn't, if companies or people did not have the infrastructure in place to sort of make sure they were following the rules and guidelines of this money, we could not give it out. And so that's what happened. And that was only with round one. And so there was a round two. We didn't get funded in round two, but in round three, the county helped us partially fund that. And then we were able to take reserve funds and fund the rest. And so everyone is getting a piece of the round three money. And we're going to try to ensure, because it is not truly CDBG money, we're able to give that money to the organizations and help them out on the paperwork, on following up, making sure everything was spent correctly.
Yeah, I think sometimes we don't appreciate how much red tape there is in trying to draw down federal funds.
Yeah, there is a lot.
And we have a good question about we talked about broadband infrastructure, but Gene Murphy asks, can some of the infrastructure funds be used to prevent hacking into the cities and I presume counties' computer systems?
And so what I've read of the American Rescue Act is that funds may be used on cybersecurity, but it was to protect water or sewer infrastructure. It didn't speak to like anything outside of those. So my feeling would be if it's to protect water, yes, we will be able to do it. But I'm not sure about any other. What are your thoughts on that, Janet?
I think as you said, Matt, I think the real key is what is authorized under the act. And we have to be so careful to make sure it's authorized under the act. So if there's a way to do it, that's certainly something we could look into. But if it's not authorized under the act, we just can't do it. We have to be mindful of that responsibility to our constituents.
Are there, I don't want to use the word creative, but only in a good sense. Are there creative ways that the funds can be used for the things the funds can be used for, and then other funding might be used for issues like this that are very important but not included in?
Well, I think one way to do that is the revenue replacement, basically, where you're basically replacing revenue that was lost because of the pandemic, and in turn, what that'll do is free up reserve funds for you to spend on those other type of projects.
And at the same time, Mari, I think one of the things that we've done is to reach out to Treasury to say, what do you mean by this? And is this an authorized, or should this be an authorized method of utilizing this fund? And so, it's sometimes a Hail Mary pass, but sometimes you got to say, this is important. And if you can't use the funds, and that's something that's important, and you can't utilize the ARPA funds for this and then free up other dollars, you just have to ask Treasury. And luckily, and I know Matt has National League of Cities and those folks to help him make those requests, but we use NACO to say, ask the folks at Treasury, can this be done? Can we utilize this? And Treasury responded pretty positively in terms of when there were questions and real kind of we hit a wall on how to use some of the CARES Act funding. Treasury came back and really modified how some of this funding could be used under ARPA. It looks like they've really opened things up, so it's much easier to do what we need to do under ARPA. But again, we have to find that authorizing language to say, yes, you can do it. But if we have a question, we'll try to get confirmation from Treasury so that we can say, yeah, it's been blessed.
Okay, great. I think you just answered another question that was posted. We have a question, really good one. How are the city and county collaborating or cooperating in using these funds so there's not duplication of effort?
Well, I can't thank the city enough for helping us. We had no expertise in figuring out how to distribute funds to small businesses, but that's something that the city has expertise a mile wide and a mile deep. And so that's when we subcontracted with the city and said, you all know how to do this and you can get it done. And as Matt said, that was part of their, I think, round 3 to get that done. So, we didn't want to flounder around when one of our colleagues can do it. And all we have to do is say, at that point, it was like, hey, Randy, we need help, And so, this has been a great collaborative effort to make sure that we do things right.
Yeah, and I think the same can be said with the health department. How we had to come together and to make sure everything was in place for contact tracing and making sure we kept the health department safe as well. So,
Yep.
Yeah.
And we, talk about the one of the best things in this county. Our health department is second to none. They have kept this community safe. They have kept us on the right path, and we cannot thank them enough for all of the work that they've done. And so that's a huge collaborative effort from city and county, and it speaks well of how the two entities work together.
Amen. Looking forward with the ARP funds, it's my understanding that the city is receiving quite a bit more funding directly that won't be coming through the county. Are there plans in place to coordinate the processes for putting that funding out?
Yes, and so we will have a pre-council meeting on the 21st. We'll sort of discuss the do's and don'ts, what our finance department is comfortable with spending this money on, and what we would suggest we don't, as well as having, I'm pretty sure we're having public comment about things that the public would want to see, but we'll have some ideas of projects that the council would like to see done as well.
And then, so the county will have access to that information?
I'm sure that there will be projects, especially projects that impact city and county. And
Yes.
So as we work together, I mean, together, remember, funding is coming, a big chunk of money is coming to the county, big chunk is coming to the city of Columbia, but there's also buckets of money that are going to other municipalities within Boone County. And so we have to sit there and think, who is with the money, and it seems like huge amounts of money, but when you start thinking about big projects, it doesn't go as far as you wish, So we have to be smart, and we have to sit there and think, is there something that Columbia does really well? And is there a project that, that we as a county need to say, do we support that? How can we support that? Is there a project that the county does really well? Is there a project that Centralia needs to have done that impacts the rest of us? How can we utilize the funds that are coming to our county wisely, transparently, accountably, and wisely, so that we have, again, that all of the people of Boone County are in a better place because of this investment. And it really is an investment. This is the ARPA fund is more of an investment in our community than just, putting a Band-Aid on and acknowledging the harm, but it's investing in our future. And that's really how we really, from my perspective, how we need to look at this fund, is say, where, because of this, is Boone County going to look different 10 years from now, 20 years from now, right? Was this money invested wisely so that we have changed what we look like we hope for the good, right?
Yes, yeah, that's an ultimate concern of ours. I mean, this can definitely help us put a foot in the right direction with where the city's going, where we're going with the county as well.
Yeah.
Lauren is asking, is there a place online that citizens can see a breakdown of the spending of these funds? It would be great for people to see the projects funded. And I realize a large portion of the funds haven't been spent yet, but I presume she's referring to the money.
CARES Act.
The CARES Act, yeah.
I don't know, on the county side, I can find out where it's posted. So I am so technologically challenged. It's funny, you guys would start laughing. So I had to get somebody to print it out for me, but I'll find out, and maybe Lauren can help us post that later, and see where the money has gone. But it's public record for the county. And we've just gotten that first tranche of funding under ARPA, and we're just kind of learning the landscape right now. And because it is a longer term project, again, we don't have that, we don't feel like we're chasing our tails trying to get this out right now. So that's we can be more mindful, I think, of it as we move forward on the ARPA funds.
And so I think that's the same with the city as well. The city does have a spot on the website where all the expenses are located. And so all the expenses related to COVID-19 are in that dashboard. And I did post that in the chat. And we have talked about having something to monitor the spending of the American Rescue Act funds, because we will have to do that anyway. So just putting something on our website, and we'll be changing our website, I believe, in the next month or two, and that'll be something that'll be included with the new website.
Thank you. There's a question about sidewalks. Are sidewalks something that could be funded with any of this money, or?
Sidewalks cannot be funded, but curb and gutter can. Most of the funding in relation to infrastructure was around water projects. So wastewater, drinking water, storm water. There is some available for the lesser served areas. So like to build up those communities and different things in those. But as of right now, from what I've seen, sidewalks will not be one of those that we would be able to do.
Thank you. Great questions, everybody. Before making new allocations, is there a plan to evaluate the impact and effectiveness of monies that have already been spent?
I believe that we are so far. So they have two different spending methods on both of these. The CARES Act money was basically to reimburse you for expenses, and this American Rescue Plan is mostly to looking forward. And so I think the evaluation and the impact will come with this American Rescue Plan money, because the other was more of a reimbursement. So
exactly, it's that was the CARES Act, kind of goes along with it's short-term handle, care. It was kind of a Band-Aid to take care of the damage that was caused. But this is prospective. ARPA is prospective, and it's one of those, are we making that system change?
Mm-hmm.
Really? And that's the real question. I mean, I think that's why when, there's been a lot of discussion in Congress about what do we mean by infrastructure? And there was a huge amount of discussion as to, what is infrastructure just roads?
Mm-hmm.
So there were a lot of folks in both the House and the Senate that moved from roads to, as Matt said, drinking water and storm water and, and sanitary sewer and those kinds of things. And then for many people, it was another discussion to bring broadband into that conversation, So the whole notion of infrastructure really was a big topic of conversation in DC. And I think that's part of what we're seeing with the language around and all of the FAQs that they're coming out with on ARPA, is that conversation that it's been more expansive. And so the question is it more expansive yet? Douglas County, Kansas looked at it and said, it's even more expansive than some of the language we're seeing. So, and they're using some of that language about folks who are underserved. What does that mean? How expansive can you be? So there's some communities that have really taken that and pushed it to meet those needs within their community. I think that's going to be a conversation that the City of Columbia, County of Boone, and all the other jurisdictions, the smaller municipalities in Boone County have that discussion as we move forward to say, what does our community look like? What changes can we make with this investment?
And will there be evaluation plans built in to the process so that looking, 10 years from now, we can look back with some kind of objective measures of?
I think there has to be, right? We have to do that. I mean, that's the one great piece about being here in Boone County. We are data driven. And so when we make those investments, we have to be mindful of, this isn't our money, it may be, Matt and I may have a small role to play in where some of it goes, but it's not our money. And so we have to say, this investment in our community, what change did it make? And so, I think it's going to be, it's our community that will be watchdogs, as well as our staff and elected officials, to say, make sure we do it right and make sure we watch it. Yeah.
Okay, well, thank you guys very much. Do you have anything you want to add briefly to that matter? Did Janet say it all?
I guess one way you'll be able to see the effectiveness of some of the CARES Act money for the city would be the airport, and then the transit system, the free transit system. So that is something that we are monitoring both of those.
Okay, thank you. Well, I want to thank both of our guest speakers, and of course, Lauren as well, and the DBRL for co-hosting the program. Thank all of you for participating and for your excellent questions. The program will be available for viewing and sharing in a day or two on the League of Women Voters Columbia Boone County website and our Facebook page. And we hope to see you all in September for our next Lunch and Learn program. Thanks very much.
Thank you.
Thanks, everyone.